So my name is Jess. I go by Jess, but you can call me Jessica. I do answer to Jessica. I am clinical nurse educator here at Hammond-Henry. I'm also the supervisor on weekends where I work on the floor. And I do a little bit of infection control as well. I started here at Hammond-Henry not quite 2 years ago. I moved from New York. I'm originally from Europe.
Can you guys hear her in the back? Okay.
Okay, yeah, if you don't just go like this and I'll talk louder. If you hear an accent, that's because I'm from Europe. I was born in Sweden, raised in France. Mom is Swedish, dad is French. But I lived in the US for about close to 30 years now. Mostly in North Carolina, about 6 years in New York, and not quite 2 years here in, I actually live in Iowa. So that's kind of my background. I am an ICU nurse. That is my passion, as well as education. So we do take care of COVID patients upstairs, ones that are regular COVID patients, not that sick, but that need hospitalization, and also the ICU COVID patients. So I lend a hand in there, and we've had some nurses that have been out sick or for personal issues. So occasionally I get called up there from my office, which is down the hall, and I go lend a hand up there. So before being a nurse, I was a paramedic. So emergency is also one of my passions. I have a lot of passions. So, and today we're going to talk about COVID. You know, it's been, can everybody see this okay, or should I turn the light off? Yeah. Oh, is that better? Oh, yeah. Okay. Okay. So it's been almost, what, 20 months since COVID started. So you probably heard a lot, some information, some misinformation, and what I have here today is a small, condensed, basic presentation on COVID. Facts, not opinions. We know that media out there is, you know, people have been fighting about the mandates for vaccines. We're not going to talk about that unless you specifically ask me for my opinion. So these are just basic facts on how to understand what COVID is really about. All right. So COVID is not our friend. We know that. Okay. No, this is not. Okay. Might be pointing a baby at your where your little thing is plugged in. Because the pointer is working. Yeah. And this is not working. Oh, there we are. Is that the next one? Yes. Perfect. So what is COVID? The name COVID comes from coronavirus disease 2019. 2019 was when it first all started in December of 2019. And it is the disease that is caused by that specific virus, which is the SARS-CoV-2 virus. Okay. There are many, many, many coronaviruses. I mean, I'm talking hundreds. They've been on Earth for hundreds of years. Coronaviruses are, like the name says, viruses. They are not bacteria. And that is important to understand because viruses cannot be treated with antibiotics. The usual medication, and when you go into the doctors, you have pneumonia, you have a sore throat from strep, you might get antibiotic, or sinus infection. Viruses cannot be treated with antibiotics, and that's what makes it difficult. The basic coronaviruses can just cause the basic common flu. If you come in with a cold, and we would do a specimen and test you, it would be probably a coronavirus. It's just not the coronavirus 19 or COVID-19, okay? So it starts with some mild symptoms, and then with COVID-19 can be more severe. It can lead to pulmonary, cardiac, and even have complications further than that. Right? Coronaviruses are named for their appearance of brown, the outside layer. Oops, okay, here we go. The outside layer has these protein spikes all around that makes it easy for them to attach to the cells. And this part right here forms a crown, which that's why they get the name corona. So we can have a common cold, like I said, also respiratory, and then severe diseases. The SARS-CoV-2, which is a COVID-19, started in China in 2019, and then became pandemic throughout the entire world. Just a little bit of biology here. This in here is the genetic material of the virus, and that's what is sent into the cells when they attack the cells of the human body. And that replicates, and that's how the virus grows and multiplies. All right, so how does it spread? How do you think it spreads? Why do we have these masks on? Because it spreads through droplets. When we laugh, when we talk, when we, of course, sneeze or cough, there are droplets that are coming outside of your body into the air. Some are larger, like this right here. Lovely, right? Some are larger, and those fall to the ground, but they also fall on tables and different surfaces. But some are so small that they stay suspended in the air. All right, and it can accumulate, especially if there's very poor ventilation in a room, or if there are a lot of people in one closed area. Those particles stay in the air, and then you can inhale them, you, me, everybody. So it's very important to, if you are in an area like this, you can hear the ACs on, to be in an area that's really well ventilated. All right, so there you go, droplets. All right, so the most important thing to prevent COVID-19 is to wear a mask. Second most important, or maybe as I want to say, maybe as important, would be hand hygiene and the physical distancing of 6 feet, minimum of 6 feet. That is to prevent COVID-19. It doesn't treat COVID-19, but it prevents it from going any further. All right, incubation period. Does anybody know what incubation period is? Incubation period is when the virus comes into your body until you show any symptoms. Okay, they're incubating, they're preparing, they're growing. All right. So symptoms can show up to from 2 days to 14 days after the exposure. That is a very large range. Okay, 2 days to 2 weeks. But what you do have to know is that a person that is infected, and sometimes we may not know that we have COVID, but a person that is infected with coronavirus is contagious for up to 2 days before the symptoms start. So let's say I'm infected today, I have no symptoms at all, I am contagious right now. So if I come and give you a hug, you might get it, okay. But I have no symptoms. So up to 2 days before the symptoms, and I can remain contagious up to 20 days, okay, depending on the person. So 10 to 20 days is, again, a very wide range. And you would ask, why 10, why 20, and why not 10 to 12, which is a closer range? Because it depends on the immune system and how severe the person is sick. We've had patients upstairs and even patients outside. They were sick with the COVID, and at day 10, they had no more symptoms. But because their immune system was weak, we kept them in isolation for about 20 days. Okay, so it's not a precise science, okay, an exact science. And we're still learning about COVID-19 as we go. So that's why that range is from 10 to 20. Does that make sense?
And our employees, if they don't show symptoms, most of them come back to work.
Yes. So if they test positive, they usually come back to work after 10 days. But again, it depends on their immune system and if they don't show any more symptoms. If they still have a fever, they're not allowed back. Hey, stop it. All right, symptoms of COVID-19. You don't have to answer, but has anybody had COVID in here? Katie? All right. Did you have a cough?
I did.
What about fevers or chills?
Yeah,
Shortness of breath, difficulty breathing,
a little bit.
muscle and body aches?
Uh-huh.
Absolutely, right?
Yeah,
Especially
that was the
joints.
worst.
Yep. Sore throat?
No.
No sore throat, okay. Congestion of the runny nose?
Yep.
Okay. Loss of taste or smell?
Still have it.
You still don't have it?
Uh-huh, still lost that, yeah.
Both smell and taste?
Mhm.
Is it coming back slowly?
Yeah,
or-
a little
It is?
bit, like very little bit, yeah.
Oh, nice.
I know she had them all.
Mhm.
That must be awful. That might
No.
be TMI, but diarrhea, no?
No, I didn't have that.
Headache,
Yes,
new fatigue,
yes,
nausea, vomiting.
no.
So you didn't have any
I had no
gastrointestinal?
GI stuff.
Okay, so everybody's different. When you get the vaccine, yes, sir.
What's the difference between that and flu?
Uh,
You haven't heard anything about flu for 20 months.
Yeah,
I
right.
haven't heard any figures, no nothing. Everything's COVID, 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 COVID.
Yeah.
I think if we get a toothache, you got COVID.
You're absolutely right. The symptoms are the same.
Right.
The symptoms are the same, and where we know that it's the flu versus COVID is by testing. That's the only way. That's the only way.
And another difference would be how contagious it is.
And how contagious it is. Well, the flu is very contagious too, but you're right. COVID is more, let's say it's more severe.
Yeah.
One thing that is different, this right here, you don't have that with the flu. Loss of smell, loss of taste. You might have a little bit just because of the drainage in the back, when you're congested, you don't have a whole lot of taste or smell. But this is long lasting, right, Katie?
Correct.
Yeah. So that's really the only difference as far as symptoms. So people have been tested for COVID. You can have the flu and COVID at the same time. But because COVID is so much more serious and severe than the flu, they've been tested for COVID. So we don't know about the flu. And you're right, the numbers have gone down because we just haven't been testing for the flu. Keeps going back. So those are the symptoms of COVID. You can have just one, you can have just a cough and be tested for COVID and be positive, right? Or like Katie, you can have most of these. She didn't have any gastrointestinal problems. Good for you, because it seems like you've been through a lot. So it varies with every person. All right. This is important. And this is why we have to wear masks, because some of us here can have the COVID virus and not know about it. Okay, I feel fine, a little bit short of breath because I'm talking and I have a mask, but not because I'm sick, but I could have COVID. Okay. What's important to understand though is that if you're not vaccinated, and you do get COVID-19, you can have respiratory failure. You can have scarring on those lungs, which will give you, where you'll have problems your entire life. Heart muscle damage as well. Nervous system problems, kidney failure, or even death. So it is serious. We should not take it lightly. Whatever people believe, it's a hoax. It's politics. I shouldn't wear the mask. I should wear the mask. I'm against the vaccine. I'm for the vaccine. All of that is personal, I guess, opinions. But the facts are real that COVID is serious and people die from it.
Hey, Jess, would you cover, so exposure, so Katie had it, so what do I do? Was I exposed, then what do I do? Since I work with Katie in an office next door, and
Well,
So
you're in
expo-
office next door.
Yeah,
Okay,
so,
so-
so what is exposure? Say you're with the family, how do you know? Should I test? I'm not having symptoms, maybe I'm one that
So
doesn't.
once you knew that Katie was tested positive, and I hope you don't mind that we talk about it.
Not at all.
How do you determine if someone has COVID if they have no symptoms at all? How do you,
Yeah.
You don't,
Test.
you don't.
Just through test, yeah.
The only way you can find out is through a test. The nasal
what
swab.
does the test tell you?
The test tells you that there are antigens of that virus.
But you really wouldn't go for a test unless you're having symptoms or you've been exposed. So I
Or
was,
you-
I was considered exposed. So exposure is, are you with that person 15 minutes or longer,
Less than 6 feet.
less than 6 feet? And were you masked during that? So if any of those three are, well, I was masked, I was 6 feet away, but I was with her longer than 15 minutes because we worked together and it was getting ready for her golf outing. So I was considered exposed once Katie called me and said, hey, I'm positive COVID. So then you wait 3 to 5 days. I waited 5 days because if I went right away, oh, I've been exposed, your symptoms typically do not show up that soon. So you wait 3 to 5 days and go be tested. So I waited. She called Saturday. It was Wednesday. I got tested. I was negative, but I waited the 5 days to have the test. So they do the nasal swab test and I was negative.
And also, before any symptoms of Katie appeared, you were working with her. So remember the 2 days before, she was probably contagious. But you always wear your mask and you're still careful because you never know, right?
Yeah.
So, yeah.
Mhm.
So really the only way to answer your question, really the only way to know is to test. Yes, sir.
What is the accuracy of the test?
The accuracy of, it depends which test you do, but the gold standard is the PCR. It's 90+%. I think it's 98%.
98 or 99, yeah.
Yeah.
Mhm.
So we have a rapid one, which is the antigen. It's pretty accurate. I want to say, I think it's around 85%, 80 to 85. I'm not sure about that number. That's the one that you get the results within 15 minutes. It's the antigen. And then if that one is negative, we usually do a PCR, which is a gold standard. And if that one is negative, then you can be sure that you don't have COVID. All right, so here we go. How is it diagnosed? It's diagnosed through a laboratory test. It's a swab, like Darcy was saying. I'm just going to call you Marcy. Darcy was saying it's a swab in the nose, and then one a little further up with a PCR, which is a gold standard, and we send that to lab and we wait till it reacts or does not react. And this is why it's hard to differentiate between the flu and the COVID, like you were asking, because the signs and symptoms are pretty much the same, right? And also, you could have strep throat, right? You could have a sore throat, an infection in your throat with a bacteria, and you show with a fever and sore throat, which are two of those symptoms of COVID, but it is not COVID, it is strep throat. So some of the symptoms can be caused by other illnesses. That's why the testing is important. And again, some people with the COVID do not show any symptoms at all. Yes, so how is it treated? There are medications that are being tested. We do have one here. It's an antiviral that we give. And then there's another one that's currently in progress of being tested. And it's really a trial. And before giving that medication, we ask the patient if they want to. Most of them say no because it's not a FDA-approved medication. So we can't really treat COVID. So what we do is that we support the symptoms that you have. If you have a severe headache, we're going to give you something for the headache. If you can't breathe, we're going to give you some oxygen. So we can't really treat COVID just yet. If you do have a fever, yeah, you'll take Tylenol or ibuprofen. It's usually over-the-counter medication. If you don't require hospitalization, you can be treated at home, treated. Cover the same signs and symptoms, yeah. Those that are more severe cases will need to be hospitalized, and they might require ventilatory support. It could be as just little as just oxygen, or as severe as having a tube down your throat and being placed on a respirator. That's what we call mechanical breathing support.
Do we keep those here if they're intubated on a tube and all that?
So when a patient is going bad, we intubate them, meaning we put that tube down into their lungs and we hook them up to a respirator. Can you still hear me in the back? Okay,
Yeah.
because my voice tends to. And we keep them here until they're stable enough to transfer. Now, recently, because people are more and more sick, not sicker, but there are more of them that are sick, all the ICU beds are occupied. So we cannot find a bed to transfer the patient to. And this happened, I want to say maybe 3 or 4 weeks ago. We had a patient that she was going really, really bad. She had to be intubated, placed on respiratory support, ventilatory support, and we kept her here, I think, for 2 days because nobody would take her. Nobody could take her. All the ICU beds were full. When you are on a ventilator for breathing, you're also sedated with medication through your IV, through your vein, and you have to be in an ICU. So we can't just ship out that patient to any hospital. It has to be an ICU. So we keep them here. We can manage, but it has to be short term because we are not really equipped to keep intubated and vented patients here for very long. But of course, we're not going to kick them out. So hopefully, eventually a patient elsewhere is well enough to leave the ICU and go home or move to another unit in the hospital, and that opens up a bed, and then we can get that bed. And that's usually what we've seen. Yes, sir.
Can you do the infusion here?
Which infusion are you talking about?
I think they call it the,
Monoclonal?
not the steroid infusion, or the Trump cocktail. Let me put it that way.
So there are things that we do here, and there are things that we do not, like the monoclonal antibodies we don't do here. Some other hospitals do them. So if that's the case, we would transfer them out if they want something like that. But we usually treat with an antiviral and oxygen. And again, if they get really bad, we transfer them out. So no, we don't do the whole cocktail. We're too small.
You've had to send some to other states because there's nothing available of ICU beds.
Iowa City, we send patients up to Chicago, all the way up to Chicago. I don't know the area too well, but our main hospital that we'd like to send the patients to are OSF in Peoria. It's a big hospital. They're used to managing vents, and they can take care of the patients. Not that we can't, but we don't have the resources here. Okay. Keeps doing that. So how do you protect yourself from this virus? All right. Again, hand hygiene, social distancing, masks do work. Masks do work. And for those that are not against it, there is the vaccine. There are several vaccines. There's the Pfizer, the Moderna, the AstraZeneca, which I don't think we have here in the Midwest, and which one am I missing? Johnson & Johnson. They are all 2 injections, except for Johnson & Johnson, which is 1 injection. If you do choose to get vaccinated and you choose one, or maybe you might not have the choice, but that has 2 injections, they're usually 3 weeks apart. The second injections might give you symptoms of the COVID-19, and that's just because your body is building immunity. The body is making all these antibodies. The body now, with an injection, has been in contact with a portion of the virus. Now, this is not a live virus, okay? So don't think that the vaccine is going to give you COVID, because it's not. It's a small protein of the virus that is injected in your body and tells your body, whoa, make antibodies to fight this. So if you do get sick after the second injection, which I have, and I'll tell you about that, it's because, not because you have COVID, but because your body is making antibodies to fight against COVID if you happen to be exposed to it. So I got both my injections of Moderna last year, well, no, this year, one in December, and then 3 weeks later. And the second one, I had 103 fever. My joints, it was so strange because my legs were fine, but it was my elbows and my wrist. I could not touch my elbows. They were so painful. They weren't swollen or anything, just very, very painful. GI, spasms in my muscles and my joints, and then a fever, terrible headache. I slept for 24 hours. It was like a switch. On, you're sick, off, you're all better. That's exactly how it was. Nothing lingering.
Yeah, the same thing. It was
Yeah.
just that when I had my second vaccine, I was terrible sick, felt awful. And then I woke up the next morning and I felt like $1 million. I'm
Yeah.
like, oh,
Yeah.
well, that was weird.
Yeah.
It
Yeah.
was strange.
Me too.
Yeah.
So keep them in mind, you know, and it's the same for the flu vaccine. If you get your flu vaccine, you hear people all the time, oh, I'm not getting the flu vaccine this year because I had, last time I had the vaccine, it made me sick, I got the flu. That's not how it works. It's your body that is making antibodies to fight against the flu that you may possibly have or been exposed to. So you don't, it's a safe vaccine. The COVID vaccine is a safe vaccine. We just don't know a whole lot about it. You've heard that there might be a booster, probably heard that. They're not sure. We're still learning about the COVID. It is, even though the coronaviruses have been present for decades, or centuries actually, this one is a new one. So we're still learning about it.
So the vaccine that's out there, how is it related to the flu vaccine that we get every year?
It is not related.
Okay,
It's a totally different virus.
Does the flu vaccine give you some of that virus? So is that the difference? When you get the flu shot, you get a little of the virus in that vaccine. Is that, I
So,
don't know.
The flu vaccine is different every year because the strain is different, because it mutates so quickly. So it changes from one, for the original cell of virus to something else. It might grow a third arm, you know, it mutates. So every year they have to create a new, they have to create a new vaccine. And so I think that the flu vaccine, I'm not sure actually if it is a live virus or not, or if it's just a portion. But the COVID vaccine is not a live virus.
so are we possibly going to have to get a COVID vaccine every year, just like we do the flu? because it
Possibly,
mutates?
possibly, or every 18 months, or, yeah. They're doing research on that, they're testing, they don't know. They don't know, but more than likely. The COVID vaccine, no, the COVID virus does not mutate as fast as the flu. So it might not be every year, but I don't think it's gonna be lifetime. You know, you get one vaccine or the two injections, and then you're good for life. I don't think that's gonna happen. Oh, dear, all the mouse around it should come out. All right. Questions?
Do you think that it's a mutation that's the cause that younger people or children are getting more vulnerable and infected than they were a year ago?
I don't think it's a mutation. I think it's a different strain. It's a different, you've heard about the Delta. I think that one is more virulent. It's meaner. So I think that, yes, the younger people are getting infected more from that strain. The original strain was not really for the younger people that they didn't want to get infected from that.
The testing,
Yes,
the antigen and then the PCR, which do you do here?
we do both.
How do you know what you're getting, which testing?
Which test you're getting?
Yeah,
There's reasons for both, right?
Yeah, there are reasons for both, but we do both. The first one is the antigen, and they know in lab which one you're getting, and they'll
how
tell
do
you.
we know?
Well, they'll tell you. They'll tell you, okay, I'm gonna do,
Because of your condition, or how do they
The
determine what
urgency,
you're getting?
urgency, or if you're having a procedure, or you can go into.
right, right. So the PCR is, like I said, the gold standard, however, it takes longer. So what they do
How long does it take for that?
to get the results,
Yeah.
about an hour. About an hour.
On the PCR?
That's your 3-day
That's the
one.
PCR. The antigen, you can get the results within 15, 20 minutes, depending on how busy they are in the lab.
And some are 3-day, your son had
Yeah,
to
like
wait
the
3.
PCR,
Right.
some of them, yeah.
So here in the hospital, there are some that are sent out to a different lab. But here in the hospital, because we need to know the results quicker, let's say I'm a nurse on the floor, right, and we're short-staffed, I have 4 patients, all of a sudden I'm not feeling well, I need to get those results quickly, because either they're negative and I can continue working and taking care of my patients, or I need to get sent home right away. So that's why we do those 2 tests on staff, on hospital staff, because we need to know the results. Some get sent out, and you'll get the results within 2-3 days, depending on where they're sent out.
I'm assuming then that as your body ages, the resistance reduces.
Correct. Correct. And that's why at first,
That's you.
let you,
Oh,
and that's why the first strain a year and a half ago, most patients were over 60, because the immunity decreases as you age. So you're more susceptible, more fragile to get any, not just a COVID, but also the flu, pneumonia. Okay.
so if you tested here, how did they inform you of the results?
As a patient or as an
Outsider,
outsider, it goes to Katie, not this Katie, our employee health nurse. Lab calls Katie, and Katie will call the person.
lady, health,
Katie, our,
health nurse,
she's
In the
our,
lab.
yes, employee health.
or call you.
The lab will call Katie, our employee health nurse, and that nurse will call out the patient. Yes, sir.
And we've talked about the vaccine. Can you go back and explain, you hear a little bit about the vaccine came so quickly. But can you talk to the carrier that's used the package, how long that's been around, and possibly where that could go in the future?
How long it's been around, I don't know. I wish I could talk about where it's gonna go in the future, but nobody knows.
Yeah, I think it's in the
Because I had heard it, it's been developed 13 years ago.
Uh,
This really, moved it up in using it. And that's where how it's being delivered, the Moderna, as well as the Johnson & Johnson. but
the Pfizer.
the Pfizer.
So, like I said before, coronaviruses they've always been around, and they have been they is the CDC. They have been in pharmaceutical, they have been working on different vaccines, okay? So the reason why it came out so quickly is that they have vaccines for other things, and all I had to do really is match which virus is closest to the COVID, and then just change that a little bit to get it to the COVID. Now, where it's gonna go in the future, I don't know. I don't know. Unfortunately, I don't know. I wish I knew, but I don't.
Two questions. What you presented here seems to have a lot of facts and a lot of strength as to why you should get the vaccine. Why is 10% of the people here refusing to get it with such strong data?
So there are some that have medical reasons. They will not get it. They have a note from their doctor. They just cannot get it. They might be on chemo. Their immunity system is really low, or really down at that point. It's really not recommended.
Those are people that are working in the hospital.
There are a couple. There are a couple.
Okay.
And then others are just their personal beliefs. They're the anti-vax, and they just will not get it. Some are also religious, have religious beliefs, and they sign a declination saying that they will not get the vaccine. And in that case, they have to wear the N95, which is the bigger, they are right, the bigger masks, and they have to get tested every week when they come into the hospital before they work.
The other question, Pfizer, of course, has been approved for a booster, and I'm assuming Johnson & Johnson and Moderna are going to do that. Since you do the Moderna, will you then offer the booster for the Moderna?
They say it doesn't matter. They say it doesn't matter. I would prefer if once Moderna comes up with a booster, since I've had the 2 injections of Moderna, I would prefer to have the booster from Moderna, but they say it doesn't matter. They also say you can get the vaccine, the COVID vaccine and the flu vaccine at the same time. I give the flu vaccine here, and people ask me about that. I said, you do whatever you want. I don't recommend it. Just because if you do have any reaction, you don't know which one it comes from. Yes, sir.
You're saying that you could get the shots at the same time. There must be a difference of opinion, because my wife just checked yesterday because she had Pfizer and she can have the booster now. But the doctor's office said, remember that if you have the Pfizer booster now, you can't have the flu shot for free for a month, or what I like to find. You can't. You got to plan ahead. You can't have one or both of them at the same time. You have to spread them out.
So that's very possible for the booster, because the booster is going to give you that just boost of antibodies. What the CDC is saying is that for those that are getting the COVID vaccine, the first 2 shots, they can get them at the same time as the flu. The booster, yeah, I would definitely not recommend, because that
Okay.
you might.
Who says there's a 30-day wait
Between a 30-day wait for what?
from your second shot to your
First shot. too.
booster?
Or the flu.
6 months there, I understand that. But now we're talking flu shot versus the booster shot. Now I'm hearing 30-day wait.
Well, yeah, 30 days.
I don't understand that, because I had my physical checkup at the doctor, and they wanted to give me I'd already had the booster shot 2 days before that. And they wanted to give me the other one right away.
I
I
don't think.
didn't take it, but I took it the following week, which is only a week's between shots, and they made no problem with it. So somebody, I guess, a lot of people are skeptical because there's been so much double talk, triple talk,
Yeah.
quadruple talk,
Yeah.
quintuple talk,
Yeah,
that nobody knows what the hell to think anymore.
absolutely. You're absolutely right.
Don't wear a mask, don't need a mask. Oh, you must wear a mask. That came from the top, right from the top. It's just crazy. You wonder why people are confused? Yeah.
Yeah, no, exactly. You're absolutely right. And then on top of that, you add media, where people just put their opinion without any facts. And then that grows into a group of, yeah, it's very confusing, and it's very frustrating. Yes, yes, yes. Doesn't
What
matter.
about the antibody testing? Do you plan on doing that here, or is that, I've heard that it's available in the Quad Cities. Is that something,
I
a lot
don't,
of people claim they've had COVID, so, did they get the antibody test?
I don't think we do it here. I don't know what the plan is to do it here. That would be a laboratory question. I think it's very expensive to get done.
I
So,
heard $10 in the Quad City.
I know you can get it through your local physician.
Yeah.
So whoever you see
Yeah,
here,
we don't
ask
do it
them.
here.
Yeah. I don't know where they send it, but you can get results through your local physician here or wherever you go.
I think it's expensive for the lab, not for the individual.
I'm thinking of the mask and that generally the cloth mask, these masks are pretty popular. How would you say, how effective are they in general? Cloth versus paper or whatever these are.
So you've probably seen the test where they blow a candle. Have you seen that online?
I think I saw one time.
No? Okay. So it's a person that's wearing a cloth mask and it has a candle and blows through the cloth mask to try to blow out the candle. And he blows it out. And then he wears one of these and he has a very hard time. It does blow out, but he has a very hard time blowing it out. So this protects better than the cloth mask. Now the N95 protect even better than the cloth mask or these.
I was using outside cleaning some grill grates with Easy Off oven cleaner.
Uh-huh.
You're supposed to use that in a lot of ventilation. And I know that really can get to you.
Yeah.
Without any mask on. I had one of these masks on,
And you smell it? You do not.
hardly.
Hardly.
It was very effective and I
Yeah.
was right down spraying Easy Off and hardly had any
That's a very good point.
sensitivity to it.
That is a very good
I
point.
thought, this is pretty good.
Yeah, they are pretty good. Now, there's also, faces are different. These are standard size. But if you have somebody that has a very small or narrow face or very wide, it might not work as well. I have seen masks, of course, masks that are wear like this, that are worn like this, of course, or like this, But I have seen masks that are open here on the side because they're too large. Okay, so if you use the, what is it called?
Easy Off.
Yeah, the Easy Off, and you smell it, that's probably where it comes here, where it's coming through. Now, up here, you have a metal part, right? If you don't mold it to your nose, particles can go in through here. So it has to be molded to your, so they are pretty good, but it also, you have to wear them correctly,
Can you
if
flip,
you are.
if it's tight or loose here, can you twist your ear thing?
So this is what you can do. If it's too loose, you cross this. Cross it on the other side. Okay, and then here, not very big, but you would fold it inside. Oops. You would fold it, make a fold inside, which I can't do on this one because it's not big enough. Okay. That's one way to make them tighter. You can also, I don't know.
So, back to the virus just momentarily, will you be offering or do you offer the booster here?
Not yet.
Okay.
No.
If they approve the Moderna, will you be offering it?
I believe so. Right now, we're waiting on that.
Okay.
So if anybody wants their booster, we're sending them to their primary care.
I see.
Yeah, we don't have it here yet. Good questions. Any other questions, concerns? Well, no, not concerns. I know we all have concerns about this. Me too. It's scary. The only thing I really can say is it's not a hoax, it's real. I've seen it. I've seen people die upstairs. I've taken care of patients that are so sick. Whatever your feelings are about the vaccine, I don't really care. I'm not going to get into that, but please wear your mask. Yes, sir.
One last question, as far as the hospital protocol and policy, at what point and what will you look at to stop wearing masks and stuff in the hospital?
Well, that's a very good question, and I wish I had an answer, but we started looking at not wearing masks anymore, and then the Delta variants came, so we were back wearing masks. So I think that until the numbers decrease drastically and we get herd immunity, most people are vaccinated, then until then, I think we're gonna have to wear masks all the time. We wear masks anyway on the floor. Then if we have to go into another building when we're not working, wearing a mask for us nurses, no big deal. And you know, people complain about masks, and I get it. I'm short of breath right now just talking and having a mask, but it's better than getting sick and not being able to breathe at all.
Well, especially last winter, when we had hardly any flu or colds. I mean, it's very effective of being out in public. I figure on wearing this in any store or around anybody this winter especially,
Yep.
and not getting
Yeah.
infected with basic colds or flu.
Yeah.
Uh,
Yeah. And the flu, if you can not have it, is better. Colds, I mean, a cold is a cold. You know, and we also have to continue with our lives and get some immunity to the common cold. You know, that it's always good to build up immunity, but by wearing this and wearing the mask and doing what you're doing, it keeps you safe from all those deadly viruses. So yeah, it's good. I live in Iowa where we don't have to mask. I wear it when I go out, not outside, but when I go to a store or a restaurant, I wear it because it does protect. They work really well. They work really well. Any questions from Zoom?
No.
No?
Good.
All right.
Thank you, Jess. We
Oh, you're
appreciate
welcome.
it. A wealth of knowledge, and it continues to grow and change every day.